Take a breath. Go on, just a normal one. You probably didn't even think about it, right? Your body just does it. It creates this little bit of a vacuum and air flows right in. But what happens when that simple automatic process fails? Well, that's when a truly remarkable and kind of counterintuitive technology takes over. Today, we're talking about positive pressure breathing. It's a life-saving idea that works by flipping the whole concept of breathing upside down. So here's our game plan. We're going to start with how this whole thing basically defies nature. Then we'll get into the super simple physics that makes it work, check out the different tools doctors have, see how the body actually reacts to this, and finally, we'll get into the really tough part, balancing the incredible benefits against some pretty serious risks. All right, first up, breathing, flipped upside down. Let's really get our heads around just how different this is from how you and I are breathing right now. Okay, this slide says it all. When you breathe normally, your diaphragm, that big muscle under your lungs, drops down. It creates a low-pressure space, a vacuum, and the air from outside is just pulled in. Easy. But with positive pressure breathing, it's the total opposite. A machine acts like a pump, and it actively pushes air into your lungs. We're going from a gentle pull to a mechanical push. And that's the official definition right there. Positive pressure breathing, or PPB, is just any method that uses air pressure higher than the atmosphere around us to force air into the lungs. It's this brilliant, totally artificial way to make sure the body gets the oxygen it absolutely needs when it can't do the job itself anymore. So, how does this push actually work? That brings us to our next section, the principle of the push. And you might think the science is going to be super complicated, but honestly, it all comes down to one of the most basic rules in all of physics. And that's it. That's the whole secret sauce right there. Stuff always moves from high pressure to low pressure. Always. It doesn't matter if we're talking about wind or water coming out of a hose, or in this case, air. Ventilators just take this basic law of the universe and put it to work. So here's how it plays out. Step 1. The machine, the ventilator, creates a pocket of high-pressure air right at the start of the airway. Step 2, since the inside of your lungs is at a lower pressure, the air has nowhere else to go. It just flows right in. It's exactly like pumping up a tire. The pump creates high pressure, and that forces the air into the lower pressure tire. Simple, elegant, and it saves lives. Okay, that leads us right into our third section, a toolkit for every need. Because when you're talking about something as critical as breathing, you better believe it is not a one-size-fits-all situation. You've got a whole range of tools for this. On the simpler end, there's CPAP. That just provides one continuous, gentle pressure to keep airways from collapsing. It's a lifesaver for people with sleep apnea. A step up from that is BiPAP, which has 2 pressure levels, a higher one for breathing in and a lower one for breathing out. That's really helpful for things like COPD flare-ups. And then you have the heavy hitter, full-on mechanical ventilation. This is when the machine completely takes over, doing all the work of breathing, usually during surgery or for someone with a severe lung injury like ARDS. Now, making the body breathe in such an unnatural way, well, that has consequences. And this is where things get really fascinating. Let's dive into section 4, the body's reaction. We're about to see the wild ripple effects that this intervention causes. And trust me, they're not all in the lungs. Okay, let's start with the good news, because there is a lot of it. For the lungs themselves, PPB is an absolute game changer. It pushes past blockages, it helps pop open all those tiny collapsed air sacs called alveoli, which is vital for getting oxygen into the blood. And maybe most importantly, it gives the patient's body a rest. The work of breathing can be exhausting, and this takes that load off. But it is a very, very fine line to walk. You can definitely have too much of a good thing. Too much pressure can cause something called barotrauma, where those little alveoli literally pop like an overinflated balloon. And too much volume of air can cause volutrauma, which overstretches and damages the delicate lung tissue. But the story doesn't end there. Not even close. In fact, the most surprising, most significant side effect of positive pressure breathing has nothing to do with the lungs at all. It's all about what it does to the heart and your entire circulatory system. So here's what's happening. All that positive pressure inside your chest doesn't just inflate the lungs, it also puts a squeeze on the big blood vessels, especially the veins trying to bring blood back to the heart. This makes it harder for the heart to fill up with blood between beats. And if less blood goes in, well, less blood gets pumped out. The result? You can see a drop in cardiac output and sometimes a dangerous drop in blood pressure. It's a huge, unintended consequence. Which brings us to our final and maybe most important section, weighing risks and rewards. This is the challenge, the constant balancing act that doctors and nurses in the ICU have to manage every single minute of every day. And this really lays out the core dilemma. On one side, PPVV is an absolute lifesaver. It guarantees the patient gets air, it boosts oxygen, it lets the body heal. But on the other side, you have the risk of lung damage, the potential to mess with heart function, and a whole list of other possible complications. It's an incredibly powerful tool with equally powerful side effects. And yet, despite those risks, it's absolutely essential. I mean, look at this. From its main job in respiratory failure to keeping people safe under anesthesia to helping with neuromuscular disorders, there are so many situations where the benefits of making sure a patient can breathe just completely outweigh the potential risks. At the end of the day, using this technology is so much more than just hooking up a machine. It takes incredible skill and constant vigilance. As one source puts it so well, you need nonstop monitoring, a deep understanding of all the settings, and a plan that's tailored to every single patient. It's not just a science, it's an art form. And that kind of leaves us with one last big thought. Positive pressure breathing is, without a doubt, a pillar of modern medicine. It's an amazing example of how we can step in when our own bodies fail. But it's also a powerful reminder of just how complex and finely tuned our natural systems are. So it makes you wonder, right? As we get better and better at this artificial push, how can we also get better at supporting the body's most fundamental need, that simple, effortless, natural pull of just breathing?